What role does inflammation play in cystic fibrosis? Imagine your lungs constantly battling an invisible enemy that never quite goes away. In cystic fibrosis, this enemy is a persistent, exaggerated immune response driven by inflammation. The root cause of cystic fibrosis is a mutation in the CFTR gene, which causes the protein responsible for chloride ion transport to malfunction. This leads to thick, sticky mucus building up in the airways, trapping bacteria and irritants. The body sees this mucus buildup as a threat and responds with inflammation, which becomes chronic and harmful over time. In the lungs of someone with cystic fibrosis, the thick mucus impairs the natural cleaning process called mucociliary clearance. This means bacteria like Pseudomonas aeruginosa can thrive and cause infections that are hard to clear. These infections trigger the immune system to respond aggressively. Neutrophils, a type of immune cell, rush to the site of infection to fight the bacteria. They try to contain the infection by engulfing bacteria, releasing reactive oxygen and nitrogen species, and secreting signaling molecules called cytokines that promote inflammation. While these immune responses are meant to protect, in cystic fibrosis they become dysregulated and excessive. The neutrophils releases neutrophil extracellular traps, which are webs of DNA and proteins that trap bacteria but also make the mucus even thicker. This thick, sticky mucus becomes a breeding ground for more bacteria, leading to a vicious cycle of infection and inflammation. The ongoing inflammation damages the lung tissue, causes airway remodeling, and leads to a decline in lung function. The persistent inflammation in cystic fibrosis is marked by high levels of inflammatory cytokines and immune cells that are not functioning normally. This hyperinflammatory state is partly due to the defective CFTR protein itself, affecting immune cells like macrophages and neutrophils. It is also driven by the constant presence of infection and mucus obstruction in the lungs. The immune system's attempt to fight infection ends up causing more damage, making the lungs less able to clear mucus and fight future infections. Because inflammation plays such a big role in lung damage in cystic fibrosis, managing it is a key part of treatment. Doctors often use anti-inflammatory medications to help reduce this harmful immune response. While traditional anti-inflammatory drugs have had mixed results, research is ongoing to develop new therapies that target specific inflammatory pathways more precisely. In addition, CFTR modulators, which improve the function of the defective protein, can also help reduce inflammation by improving mucus hydration and decreasing infection risk. In summary, inflammation in cystic fibrosis is a chronic, exaggerated immune response to persistent infection and mucus buildup. It contributes significantly to lung tissue damage and disease progression. Managing inflammation alongside infection control and correcting the underlying genetic defect is essential for preserving lung function and improving quality of life for people with cystic fibrosis. Always consult healthcare professionals for personalized treatment options, as each person's experience with cystic fibrosis can vary.